Hello, my name is Jessica. I'm going to be doing a musculoskeletal examination on you today. So I've already identified the patient with his name and date of birth. I've washed my hands. So I'm just going to grab some gloves. And I'm going to start by inspecting. So I would just inspect his neck. And his neck is symmetrical. There's no abnormal findings. Then I would inspect his shoulders. And his shoulders are symmetric. There's no abnormal findings. Next, I would check his arms and his elbows. Okay. And his wrists. This wrist too. And they're symmetric. There's no abnormal findings. And then I would check his hands and his fingers. And again, symmetric bilaterally, no abnormal findings. And now I'm going to ask if you can stand. I'm going to take a look at your hips. So I'm just going to lift. Okay. No abnormal findings. And just stay standing. I'm going to take a look at your thighs, your knees, and your legs. It's all symmetric, no abnormal findings. And then your ankles and your feet. So go ahead and sit down. I'm going to take a look at the bottom of your feet too. And his ankles and his feet are symmetric, no abnormal findings. Next, I'm going to do range of motion. Okay. So we're going to start with your neck, okay? So I want you to flex, and I want you to do chin to chest like that. Very good. And then I want you to extend, so I want you to tilt your head back and look up at the ceiling. Very good. And then ear to shoulder, ear to shoulder. Very good. And then just rotate side to side. Any pain?
No pain.
Okay, full range of motion to the neck. And then we're going to do shoulders. So for this one, can you please stand? And I want you to flex, so I want you to put your hands up over your head like this. Very good. And then extend, so put your hands back like this behind your back. Very good. Okay, so one more thing for your neck. If you can just cross like this. For your shoulders, I'm sorry. Okay, very good. Now you can go ahead and sit down. So we're going to do your elbows next. So for your elbows, I want you to bend and then straighten out. Bend and straighten out. Very good. Now we're going to do the range of motion for your wrists. So for your wrist, I just want you to point, put your hands out, put your fingers up towards the ceiling, and then down towards the floor. Very good. Okay, now I'm going to test the range of motion in your spine. So if you can please stand. And then I want you to flex. So I'm going to ask that you bend forward and touch your toes. Very good. Okay, and then extend, so maybe turn this way a little bit. So, okay, and then extend, so just move far, back as far as you can. Very good. Okay, and then we're going to do, I just want you to bend at your waist, side to side. Very good, and then just twist, side to side. Okay, very good. Now I'm going to do for your hips, the range of motion for your hips. So for that, if you can please lay down. And I want you to flex your right leg up. Very good. And then your left leg up. Very good. And then I want to do extension. So if you can lay on your belly And then I want you to lift your legs up. You can do one at a time up to the ceiling. Very good. And the other leg. Very good. Okay. Now I want you to lay back on your back. And we're going to do abduction and adduction. So first we're going to do abduction. So I want you to move your right leg outward to the right. Very good. And then your left leg to the left. Very good. And then for adduction, I want you to lift your leg a little bit, your left leg, and put your right leg underneath it. Very good. And then lift your right leg. And then, exactly. Okay. Very good. And next, we're going to do your knees. So if you can please, we'll flex first. So I want you to bend your knees to your chest. Very good. And extend. Okay, very good. And then next we're going to do ankles. We're just going to do eversion and inversion. So I want you to move your feet inward like this and then outward like this. Very good. And then we're going to do plantar and dorsiflex. So I want you to point your toes up to the ceiling and then down to the floor. Very good. Okay. Now we're going to do strength. So you can come back over here. And we're going to do the strength in your neck. So I want you to push against my resistance. I'm going to resist your movement. Okay? So I want you to move your neck to the right as I resist. Very good. And then to the left as I resist. Very good. Okay. Next we're going to do shoulders. So I'm going to push down on your shoulders and I want you to shrug your shoulders up. Okay? Very good. Okay. And next we're going to do elbows. So I want you to curl your elbows like this. And I'm going to pull. And then I want you to straighten them and I'm going to push. Okay?
Okay.
So go ahead and curl. Very good. And then try to straighten them. Very good. Okay. And then we're going to do your range of your strength, in your wrists. So I want you to extend your arms out. And then I want you to point your wrist upward. And I'm going to push against your palm. Okay? Okay? Very good. And then I want you to point your fingers down. And I'm just going to feel, okay, the strength. Very good. Okay. Now we're going to do the strength in your hands. So for this part, I'm going to, I want you to hold on to my fingers. And don't let go. I'm going to pull back. Okay? Very good. Okay, and then next we're going to do hip strength. So for this, I want you to, I'm going to push down against your knees, and I want you to move your knees up, okay, as I push down. Okay, ready?
Mm-hmm.
Okay. Very good. We're going to do this one. Very good. Okay, and next we're going to test the strength in your legs. So I want you to, your knees, So I want you to straighten your legs out as I push down on your shins. Okay, very good. I'll do this one. Straighten it as I push down on your shins. Very good. Okay, and then we're going to test the strength in your ankles. So I want you to push down like as if you're pushing on a gas pedal. And then I'm going to push the soles of your feet up. Okay? Ready?
Mm-hmm.
Okay. Okay, very good. So his strength is all 5 out of 5. Now we're going to do a few exams. And we're going to start off with your hand exams. And this is called the Fallon's test. And I want you to flex your wrists like this for 60 seconds, okay?
Okay.
You doing okay?
Yeah.
Very good. Any numbness or tingling?
None.
Okay. Any aches?
Nope.
Okay. Next we're going to do the Tinel's exam. So I'm just going to tap over the median nerve at the wrist. And let me know if you feel any pain.
None.
Any numbness or tingling?
None.
Okay. So the Fallon's and the Tinel's tests are both used to assess for carpal tunnel. And any numbness or tingling or aches in the second, third, or fourth digits would be indicative of a positive test. Okay, so next I'm going to do your test for your shoulders. And so I'm going to ask that you can face that way with the wall for just the purposes of the video. And then this is to assess for shoulder impingement. So we're going to do the knees. I'm just going to stabilize your scapula here, and then I'm going to flex your arm while it's internally rotated upward, okay? Let me know if you have any pain. You okay? Okay. Again, I'm going to stabilize the scapula, flex the arm internally. Very good. Okay. And then you can look forward. And then next, we're going to do the Hawkins. And for this one, I'm going to internally rotate your arm. And then we're going to elevate it to 90 degrees. Very good. And same thing. I'm going to internally rotate your arm. And then elevate it to 90 degrees. Okay. Any pain?
None.
Okay. So those are for shoulder impingement, and pain would indicate a positive test. Okay. So next we're going to do some tests on your knees.
Okay.
So I'm going to ask that you come lay on the bed. So I'm going to start with the McMurray's test, and that one is to evaluate your meniscus. So basically I'm going to flex your knee, and then I'm going to externally rotate it, and then I'm going to flex and extend. Flex and extend. And this is testing for the medial meniscus. And then to test for the lateral meniscus, I'm going to internally rotate it, and I'm going to flex and extend. Flex and extend. And normally in a clinical setting, since the bed's narrower, I would stand on his left side to do the same on the left leg. And any snapping would indicate a positive test. Next, I'm going to do the Lachman's test, and that one's to test for your ACL. So for this one, I'm going to flex your knee at about 30 degrees, and then I'm going to grasp your femur and your tibia, like so, and I'm going to move the femur forward and your tibia back. Any pain?
No pain.
Okay. And again, I would do the same on the other leg. The next exam is also for the ACL, and this is the anterior posterior drawer test. So for this one, I'm going to flex your knee about 90 degrees, like so, and then I'm going to touch your tibia right here, and then I'm going to pull anteriorly and pull posteriorly. And any laxity in either one of these tests would indicate a positive test. Okay? And then the last exam is a straight leg raise. So for this, we're going to flex your leg at your knee. And I'm going to move it like this. And then I'm going to dorsiflex. Any pain?
None.
Okay. And that concludes the musculoskeletal examination.